Hi guys, welcome back to another video. I'm back again with another video. I know I have been so consistent. I would like to think so. Thank you for stopping by. So like you already know by the title, I will be talking about my breastfeeding struggle and my breastfeeding journey. So if you don't know, I have a daughter. I gave birth to her June 9, 2020. So I gave birth in the pandemic. So I'm talking about my breastfeeding journey. So before I conceived, I went for physical examination, gynecological examination, obstetric examination, and the doctor told me that I was going to have difficulty in breastfeeding because of the way my nipples are. Please, if you're not okay with this topic, it is time for you to go watch my other videos because I will be talking about some sensitive things, the body parts. So please, it's now time for you to go out, but if you're interested, keep on watching. So when she told me this, I'm like, what is this one saying? She's not saying what I want to hear. She's not saying the right thing. I don't care what she's saying. But at the back of my mind, I was worried. So she told me that I should get someone that will be sucking the nipple to bring them out so that I'll be able to feed my daughter, or I should get a suction ball to bring out the nipple. And if you already know, I'm in a long distance relationship, so I wasn't having any sexual intimacy with anyone, and I couldn't get that nipple suction thing because I did not know where to get it, and I didn't really have it in mind to do that. So what I did was that I got a breast pump, the Advent Philip breast pump, and I was trying to use it to try and break out my nipple. This was around my third trimester. Beginning of my third trimester, I started using that, but I did not want to make myself to have early contraction. That means having premature contraction, to have premature delivery. So I started doing that, and it was actually coming out the right one, but the left one was still like that. So that didn't happen. That didn't work out well. Then on the day of my delivery was the gang. I saw something, so I gave birth to my baby, and it was time to start breastfeeding my daughter. After they've cleaned us, and I couldn't do it. It wasn't working. It wasn't what I planned of doing. By the way, I gave birth by 12:30, but on the immunization paper, on the birth certificate, I gave birth by 1 a.m. So it was already late in the night, and we didn't bring formula. I don't know what I was thinking. I forgot to bring the formula. My mom also forgot to bring the formula because my birth was not planned. Yeah, because I went in for monitoring. I will talk about this in my next video. Yeah, so by 1 a.m. I didn't have food to give my daughter, my baby. She was not crying initially, but she started crying. So what we did was that we made her stop crying, and then the next morning my mom had to rush out. She had to rush out as early as 6:30 to go get the formula. So I was trying, I couldn't even position myself well. Like, I didn't really know that it's the black side of the breast, the areola, that has to be in the baby's mouth and not the nipple. I'll insert a picture of myself trying to breastfeed my baby above or below. Yeah, so that was what happened. I was a newbie, so I didn't know anything about that, but I had my breast pump. I tried to pump. It was painful. I didn't know how to use the Advent Philip manual pump, so I used that. It was painful, and it was just bringing out small colostrum. That's the first milk that a woman produces, so it was bringing out those things. And I remember us using a syringe to feed my baby with it when we've made a big one, which was very little, so I don't think we actually used it. Yeah, so that was the first few hours of giving birth. I wasn't able to breastfeed. So the next morning, the nurses came and they said about giving my baby food. I said no, that my mom went to get the after me, so that I have to give her milk. If not, she's going to have low sugar, hypoglycemia, and I did not want that. So immediately my mom came, we made the after meal formula and we gave her via a bottle, which I shouldn't have done initially because she prefers drinking via the bottle and not trying to nurse on my chest, which was the second struggle that I had to deal with. So she got the milk and then we gave, okay, they did the blood sugar test and it was 2.2. That's the lowest. If it had gotten lower than that, my baby would have entered hypoglycemic state. So we gave her the milk, she drank it. By the way, the doctor came in and said, I told you that this was going to happen. So you might not be able to nurse your child, blah, 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 blah. I did not say anything to her. So the doctor, my gynecologist, the lady that did my delivery, told the nurses, because it's a clinic, that they should get a syringe to use to draw out my nipple. And I'm like, okay. So they brought the syringe, removed the place that you have to draw out to give the injection. If you can imagine what it looks like, I'll put up a picture in the video so you can see what it looks like. So they brought it, they removed the upper part, and then they tried to bring out, they used scissors and cut the other part a little bit, and they tried to do that. It was so painful, like you could cry. And I was determined to nurse my child because people say that you should nurse your child, that that's the best thing for you, that if you don't do that, you are less of a woman. So I was determined to do that, but it was so painful. So the next morning, I did my blood test to see if my hemoglobin was normal before I can go home, and my daughter did a serum bilirubin test to check for jaundice, even though it was not seen physically. So the result came out and it was okay. So we left that same day. So when I got home, that was the second day, I tried pumping. This time around, I used the electric pump. I got the Dr. Jim electric pump. Then it was working a little bit. I was bringing out the colostrum, but the third day was when the colostrum started coming out very much, and the transitional milk, that is the milk after the colostrum and before your mature milk. So I made lots of it. I was giving my baby while still giving her the formula. So I was giving her breast milk and formula via a bottle, and she would gulp the milk so fast. I have to burp her so many times. And if you don't know the struggles of burping a baby, that's another topic altogether. It can take you minutes to burp a baby. So I did that, and still I was determined to nurse my child. I remember when I went for our 1 week check-up, I would see babies nursing. I would see babies, like very little baby, like a newborn baby, rooting for the breast when the mom carries her or him. I don't know the gender of that baby. They will move to the direction of the breast, meaning that they are hungry and they just want to nurse, they want to feed. And I will be so sad, I will be so jealous, I will feel defeated that I'm a bad mom, I couldn't breastfeed my child. So I made an effort to buy a nipple shield. So I bought an expensive one, the Haka nipple shield. This particular nipple shield came with a bottle teat, so it was familiar for my baby. So when I placed the nipple shield that looked like a bottle nipple, she recognized it and she was able to nurse from my chest. And was I so happy? I was so elated. I was so happy and thankful to God for making this work. But I needed her to nurse on my skin because I would have to sterilize, wash those things, sterilize it, and it was time consuming and just bringing out your breast and putting it in your child's mouth and let her nurse by herself. So I was determined. By then, this was the 7th day the 8th day. I started using it on the 8th day. And the next day, I said, okay, let me try and see if my daughter will nurse on me without the nipple shield. And to my greatest surprise, she did. It was as if I won a jackpot. I was so happy. That was not the beginning of our nursing without using the nipple shield. So I threw the nipple shield aside and we started our breastfeeding journey. At night, I'm like, I can't do this every time, so I'll give her to my mom, because my mom was doing omugwo in my room, because I stay at home with my parents for now. If you watched my Get to Know Me Better tag, you will know the reason. So she will take the baby and then make formula, feed the baby, while I will rest, like have like an hour or 2 hours sleep. Yeah, so it was not until our 12th day of life that I decided that I just want to give my baby breast milk. I don't want to give her formula, I don't want to give her water, because we gave her water like once or twice. I don't want to give her anything. I want to do exclusive breastfeeding. I took that decision and I stood by it, even though my mom will sometimes, but not always, once or twice, will say, give this baby formula, she's crying in the night. I'm like, no, she's not crying because she's hungry, she's crying because her tummy hurts her. By the way, it's not all the time that babies cry because they are hungry. No, they are human beings and they can have discomfort. They can have poopy or wet diapers that are making them cry. They can have they can be teething at an early stage, so it can making them cry. If they are uncomfortable, they will cry. And they can have colic, that is abdominal discomfort. Yeah, so they can cry because of this. It's called the winch hours. So my baby was having this right on the 3rd week. She had it for, I would say, for 2 weeks or so. So I was still breastfeeding her, trying to boil her, trying to console her, trying to make her to stop crying. So I started my exclusive breastfeeding journey on the 12th day of my daughter's life. Up until the 6th month, I didn't give her water, I didn't give her formula. Yeah, so what I did was that I was breastfeeding her every 1 to 2 hours. It was so draining, but I knew the nutrients she was getting from me. Sometimes she will even nurse every 30 minutes when she's having a growth spurt. Yeah, so when she's cluster feeding, formula fed babies also cluster feed. So I kept breastfeeding her. It was a chore. What I was doing was mainly nursing her, and some nights she would sleep well. She wasn't really sleeping that well, maybe 5 hours stretch, then every 3 to 2 hours. I was grateful that I was also napping a little bit, and I'm so grateful for my mom. She will wake up early in the morning and take the baby, give her the milk that I will pump, but I was also pumping in the morning or anytime I wake up and feel so full, so engorged. I will pump breast milk or during the day, because I know that in the morning my mom lets me have like 2 to 3 hours sleep. So she will take the baby, bring out the milk from the freezer, warm it up and give it to her while I have my beauty sleep. So that continued up until 6 months. Whenever we go for our immunization, they will ask, are you breastfeeding or formula feeding? I said, I'm breastfeeding. The way they even ask as if it's a sin to formula feed. It's not a sin to formula feed. Feed is better. Whatever you have, feed your child. If you are able to exclusively breastfeed your child, great. If you are not able to exclusively breastfeed your child and you have to supplement with formula, that's great too. And if you're not able to produce any breast milk, then that's also great to give your child formula. I've made videos on how to increase your breast milk supply. Please, if you're interested in that, please click the link in the description box. You will see the video and you can watch it. So please, feed is best. So that was how my 6-month exclusive breastfeeding journey went. Then after my 6-month exclusive breastfeeding, I decided that I want to continue breastfeeding. let us go backwards. So when I was having my struggle, like from my nipple size to my baby preferring the bottles to nursing, whenever I bring her to my breast, to my chest, she will cry. She will cry so hard that she doesn't want to be in that position. So she'll cry so hard that I shouldn't put her in that position. I shouldn't take her to that area, and I felt so defeated. So when I was having that struggle, I said that I hope to nurse my child for 4 months, then continue pumping or stop breastfeeding. So when I clocked 4 months, I said let us move it to 6 months, and I was not enjoying it. I said, okay, can we move it to 1 year? And then when I clocked 10 months, I'm like, I don't want to do this anymore. I am already tired. I have a video of why I stopped breastfeeding and how I stopped breastfeeding. If you want to watch this video, you can click the link up or click the link below to view this video. Thank you. So I started my weaning process. I won't talk about it in this video. You can click the link to watch the video, okay? So I won't make this video long. So when she turned 6 months, I decided that I want to continue breastfeeding. So I started introducing solid, and I was breastfeeding her. I started with the pear, avocado pear, or rather my mom started the solid, introducing solid with the egg yolk. So one type of food for 2 days, so that we can see if she will develop an allergy to the food. We're giving egg yolk, avocado, banana, apples. So we will steam the apples, or we will mash the banana, blend it, and we'll give it to her. Then we're giving her soup, the ogbono soup for my Nigerians. Give her a little bit of egusi soup. Prior to that, I haven't given my daughter any solid, just milk. Please, milk, be it breast milk or formula milk, is the only food that a child needs from birth up until 6 months. So we were introducing solid to her. I bought the Garba cereal. I was doing more breastfeeding up until she turned 8 months. I also gave her not just the Garba, also the August Secret, the mixer grain. I started giving her that one. Then when she got older, I started giving her the nutty milk. So I gave her more of puree and fruit. So I will blend, like maybe I'll blend sweet potato with the apples and pear, avocado pear, and I will put them in jars and keep them in the freezer and give it to her within 3 days. Or I will cook rice with meat, then add a fruit, can be bananas or avocado pear or apples or mango. I will just mix it together, or I will blend yam. All these things, I'll just mix them together and I'll give her. This was what was happening up until when I turned 10 months postpartum. One day I was lying down nursing her and I was done. I decided to stop. So I started dropping each breastfeeding section one after the other and reducing the frequency of how I breastfed her. I said I was not going to talk about how I stopped breastfeeding my daughter. So this is one of the things I did to stop breastfeeding her. So I bought formula when she was 10 months plus. Instead of me giving her breast milk, I give her formula during that breastfeeding section. So that was what I did, and by almost 12 months we stopped our breastfeeding journey to the sweet bitter experience, because now I do sleep very well. Breastfeeding in the night was one of the reasons I wasn't having enough sleep, because she wasn't now sucking for nutrient. She was sucking for nutrient and more of comfort, if you understand. So she was comfort nursing. Yeah, and I didn't say anything bad with that. And because she will also have growth sprouts when she will be nursing more, and when she's still in, she would like to suck so that she would soothe herself. So it was a lot for me, and I decided that I was already done breastfeeding. So this is my breastfeeding journey and my struggle while breastfeeding. I just thought it wise to tell you my breastfeeding journey and struggle, since I have made videos on how to stop breastfeeding and why I stopped breastfeeding, on the benefit of breastfeeding, on breastfeeding essentials, on how to increase your breast milk supply. So why don't I make a video on my breastfeeding journey and struggle? So I have done it already. If you like this video, please click on the like button and subscribe for more videos if you haven't. Until next time, stay safe, stay happy, stay well. Bye. See you in my next video.